The Minister of Health says the problem of illicit trading of drugs has been ongoing for years. The illicit trading of medical drugs in Trinidad and Tobago came into focus this week. But the Health Minister says it is, however, not under his purview to deal directly with this difficulty. Marie-Therese Bernard has this report.
Earlier this week, Crime Stoppers at a forum geared towards tackling illicit trading practices revealed that bogus Viagra and birth control pills are being brought into this country. The Minister of Health says this is nothing new.
The issue of suitcase trading in drugs is as old as I am. This has been going on for decades. The primary responsibility for curbing this lies with the agencies that man our ports of entry, and also with the pharmacy board, which has control over the practice of pharmacy.
Minister Deyalsingh says they are willing to work with other agencies to bring about a resolution. He notes the problem is greatest at our borders.
And you would have seen recently in a joint select committee where we have scanners at the port lying down there for 3 years and can't be used. Now, these are the tools that can be used.
Minister Deyalsingh says 36 years ago when he graduated as a pharmacist, this problem existed. He says many have made their fortunes off this underground trade. And he points out that it's not only medicines which are being traded in this way.
And it is not only suitcase drugs. You have container loads of counterfeit cigarettes coming into this country that are even more dangerous than the legal product. Because these cigarettes that are coming in have all sorts of chemicals in it.
The minister says the bogus cigarettes are coming in by the container load and are a serious public health hazard. He believes the best solution in this situation is to stop smoking. The rest, he says, lies with our border security, which the Ministry of Health is ready to work with. Marie-Therese Bernard, C News.
And the Minister of Health clarified the issues surrounding the need for the Port of Spain General Hospital Central Block to be rebuilt. He said he was left to this problem by the past administration.
No one can tell me what was the justification for building Couva and ignoring Port of Spain for 5 years when the price of oil was $100 plus per barrel. We are committed to having a permanent solution to Central Block, even though the price of oil is $40 a barrel.
The minister said a new block is to be constructed, which will include more beds to accommodate a larger population and the expansion in services which will be provided.
Therefore, we are mandated to find a permanent solution to the Central Block issue. I took a note to Cabinet, which was approved, and I made a statement in the last sitting of Parliament in the last session, where I said that Cabinet has agreed to the building of a new Central Block with a minimum of 500 beds.
He said after an operational plan is devised and the Cabinet gives its approval, the populace will be informed on how they plan to move forward.
Our team will be down here next week from Paho, and we are making a site visit to confirm what we have chosen as a possible site, the possible bed mix going forward.
The minister acknowledged that although the Central Block is not as sturdy as it could be, there is no other alternative for patients just yet.